My name is AJ Moondra. I'm a cardiac electrophysiologist at Morton Plant Hospital. The heart rate is typically, for the average person, is between 60 to 80 beats per minute, and that increases with activity. But in some people, their heart rhythms can go fast without even doing anything, without doing activity, and we call those tachycardias, fast heart rates. And that can cause symptoms such as palpitations, near syncope, which is near passing out, shortness of breath, fatigue, as well as leg swelling and congestive heart failure. Some of these conditions are benign, meaning they're not life-threatening, but they affect your quality of life. Other ones are more severe and more serious and require more urgent attention and can be associated with what we call sudden cardiac arrest or sudden cardiac death. The conditions that are most commonly seen that are benign include paroxysmal supraventricular tachycardia, also known as PSVT, and people are born with this. However, the symptoms don't present usually till your teens or even in your middle age years. This one's benign, and this one's easily treatable with catheter ablation. The other diseases that can cause fast heart rhythms are known as atrial fibrillation or atrial flutter, and that's more common in the elderly population with an increase in prevalence as you get older and older and older. And 1 in 4 patients will have that condition by the age of 70. Again, the symptoms of atrial fibrillation and flutter can be similar to what I said with the tachycardias, palpitations, lightheadedness, shortness of breath, fatigue, etc. And those can also be treated with ablation as well.
The second category is ventricular tachycardias. These come from the lower chambers of the heart. These arrhythmias are potentially life-threatening. These arrhythmias require a very aggressive treatment. These arrhythmias are associated many times to conditions such as coronary artery disease. For example, patients that have had heart attacks and that develop scars in the heart, and that makes them more prone to having this type of rhythm problem.
The bottom line is, for treatments for these heart rhythm problems, you have to look at quality of life and also what conditions are life-threatening, and use those two parameters to decide how you should be treated. And there should be a holistic approach to each patient, individualized to each patient, to determine what is the best treatment strategy. And in some cases it's catheter ablation, in some cases it's medical therapy, in some cases it's neither. But those conditions have to be treated on an individual basis and depend on how severe they are.